I will be brief, as there are medical students and doctors behind me that can speak to the safety and efficacy of widespread vaccination. We've also provided you a packet from many other doctors, nurses, medical professionals here in Rhode Island that are concerned about this bill that couldn't be here today. So I just first want to echo, as our director stated in her letter before you, that vaccination is one of the most significant public health achievements of the 20th century. In the last 2 decades, immunizations have prevented more than 21 million hospitalizations, 732 pediatric deaths in the United States alone. I want to also state that everyone here and everyone here behind me is concerned with safety and safety of their children, their families, and that isn't lost on us. But I do want to stress that serious adverse reactions to vaccination are extremely rare, literally 1 in a million. As with any medical procedure, there are risks. But what would be much worse is a society where we see a resurgence of diseases that kill and permanently injure our country by the thousands. And that's exactly what we're starting to see happen right now with the resurgence of measles. Measles was considered to be eradicated in 2000. Today, for the 3rd week in a row, CDC has added dozens of new reports to this year's list of confirmed measles cases, bringing the total to 704 in 22 states. I also want to mention that states that have the philosophical exemption are experiencing higher rates of outbreaks, such as Washington, which we have seen. They actually just passed a bill to rein that back a little bit. Unfortunately, that was driven, by a lot of vaccine hesitancy, and opposition to vaccination has been driven a lot by misinformation that's been circulating about vaccine safety. But the fact remains that the CDC, World Health Organization, and basically every medical professional organization that does this research into vaccine safety has all research has shown that vaccines are safe. And, few things have been studied as much as vaccines. If you do a quick PubMed search for HIV, you'll see a number of research articles, but if you did vaccines, you'd see many, many, many more. So you'll hear from many about concerns over the money in pharmaceuticals, and that is of concern. But the scientific consensus of the CDC, the World Health Organization, they're not part of a big pharma conspiracy that's only out there to make money. They're here to protect the health of the public as best they can. You'll hear, like I mentioned, you'll hear from other doctors, immunologists, virologists, researchers as well in your packets. I just want you to keep in mind as you hear that statistic that recent studies by Markets and Markets have projected that by 2026, the alternative medicine market will be worth over $200 billion, whereas the vaccine market will be worth $50 billion. So there's money to be made in spreading vaccine hesitancy. Many of the folks you'll see online spreading a lot of misinformation, the Del Bigtrees, the David Wolfs, Andrew Wakefields, often are pushing a product, a book as well. So I'd like you to keep that in mind as you hear testimony. And with that, I'm happy to answer any questions and kick it to those.
Are there any questions?
Thank you, Chairman and members of the committee, for giving me the opportunity to speak today. I have some written testimony from myself and also some physicians who weren't able to attend, so I'll make sure you all get that. I'm here to voice strong opposition to this bill. I'm just going to kind of speak to a couple of points that I've heard. First, Representative Phillips, to your point about there being division within the medical community, I just want to offer that the pediatrician that you heard from is certainly in the minority. There is really broad consensus in the medical community that vaccines are safe and effective. So I would hate for you to leave today with the misconception that that is not the case. I would also like to address your point that there's research on both sides suggesting that vaccines are not safe and effective. Again, the vast majority of research suggests that vaccines are extremely effective and safe. I don't want to suggest that there is no risk to vaccines, but the risk to the diseases that they prevent are substantially higher than any risk that you can get from the vaccine. I forgot to introduce myself. My name is Christie Blackwood. I'm a medical student as well as a student of population medicine. And to that point, I just want to say that I am with everyone here. I want kids and folks to be safe and healthy, but I'm trained to evaluate the evidence and how to do that. And looking at the evidence, it is overwhelmingly the case that vaccination is the way to do that. We do have research that says people with certain medical conditions, including cancer patients, people with autoimmune diseases, those with transplant patients, HIV patients, they're not safe to have vaccines. To the woman's point earlier with that certain mutation, there are reasons that you wouldn't get vaccines. The research supports medical exemptions.
Hi, everybody. My name is Dr. Mohammed Naima Dean. I'm sorry I don't remember Robert's rules very well, so I'll probably blabber. I'm a pulmonary and critical care physician at Rhode Island Hospital, the Miriam Hospital, and the VA Medical Center. I've been in practice as a trainee for the past 6 years, and in that time I have lost, I was trying to do a mental tally, somewhere close to 400, if not more, patients to vaccine-preventable illnesses that were under 20 years of age. I've lost greater than 600, at the very least, patients greater than 30 years old, who were immunocompromised at times of admission to, as I can only presume, illnesses that they acquired in the community that were vaccine preventable. These include hepatitis and influenza. These are dangerous diseases. While all of us would like to focus on safety for everybody involved, the fact of the matter remains that human society as a whole is living longer today because of one of the greatest advancements in civilization, and to ignore that is fallacy. My last point is that by including a philosophical exemption here that pertains particularly to children, we are instilling within them the belief that vaccines do not work, whether they believe it or not, because I am 100% convinced that I will not be able to convince anybody on the pro side here that vaccines can be safe. I'm even more convinced that if a kid is brought up, no matter how well a thinker they are, how intuitive they are, by the time they reach 18, if they're able to make their own decisions, if from early on they've been told by laws that I'm allowed to make an exemption because vaccines are wrong, they're going to believe vaccines are wrong. And then furthermore, we're going to have more deaths as a result. Now, this is my opinion, but is an opinion shared by many other physicians out there. I'm sorry I did not provide any written testimony, and thank you for the time.
Doctor, if my children are vaccinated and somebody else's children are not vaccinated, and they come in contact with somebody that's a disease carrier, they go and be around my children, they can still get the disease, right?
I'm sorry, can you repeat one more time for me?
All right, if my children are all vaccinated from let's say the mumps, I don't know, the measles. If somebody's children who's not vaccinated comes in contact with somebody that's a carrier of measles, mumps, whatever the disease is, my children can still catch it, as far as I know.
So unfortunately, I'm not a infectious disease expert or epidemiologist, but as a whole, if you are vaccinated against something, you may be able to carry it, but you may still catch something if a specific strain of the disease is that you're not immune against. So you may be vaccinated against certain strains of diseases, but you may still be susceptible to it. But the key important factor here is that these kind of illnesses are human spread. So if the only way to get it is from other humans, and vaccines create herd immunity that allows for decrease in chance of transmission. And when that number falls below 95%, you lose a logarithmic number of protection. And by every percentage point dropping from 95, the protection that society as a whole has just plummets. Yeah.
And Bernadette McDonald, RN. Bernadette. Whoops, you all right? There we go. School nurse teacher from Wyman Elementary School in the great city of Warwick. Welcome. Please proceed. Mrs. McDowell, excuse me.
That's okay. Thank you. Thank you, Chairman and members of HEW. I am opposing Bill 5165. There has been a letter in opposition written by Rhode Island Certified School Nurse Teachers. I am not representing that. I'm just representing myself. As a certified school nurse teacher, I maintain the vaccine records. Rhode Island does have a very high rate of vaccine compliance. We do provide the vaccine that's free, that's not a burden for the parents, and we do have exemptions for medical and religious exemptions. We have had no measles outbreaks in Rhode Island, as someone had said before, that would probably be something that mentioned, but Rhode Island is a very diverse population. We have a lot of travel to many other states and countries. This is a disease that has been eradicated and now has a resurgence because people are not getting the vaccines and the herd immunity is going down. There are many children that cannot get vaccines because they're immunosuppressant, or they're too young, or they have a medical reason. I am very opposed to this with all of the travel that goes on within this country, within states and different countries and third world countries. These are vaccine-preventable diseases that causes problems for the children, and I'm opposed to it. Thank you.
I'm Dr. Daniel Blatt. I am a board-certified pediatrician. I'm also training as a pediatric infectious disease doctor at Brown and Hasbro Children's Hospital. Everything I say are my views and not representative of the hospital, although I can definitely say a lot of my colleagues would agree with me. I am not in support of this bill, and I'll say for a number of reasons. So everybody here on the pro side, on the con side, the lawmakers, everyone in the state of Rhode Island wants their children to be healthy. There's no doubt about that. We want their children to be healthy in the safest way possible. Excuse me if I get a little emotional. I have some sick children in the hospital right now from vaccine-preventable illnesses. But you're going to hear stories in the pro side, on the con side, and you're going to hear data. You're going to hear a lot of data saying vaccines are safe and effective, and you may hear some data say that they're not. I cannot attest to the data saying they're not because it's hard for me to find those studies, but it's easier for me to find the studies pro vaccines. But I'm not saying they don't exist, and I'm not saying vaccines are 100% anything. Safe, not safe. I don't think this is the forum to debate the data. The forum to debate the data is in the scientific literature. I only have 2 minutes to talk to you, and I'm not going to convince you how all the science works. I don't know how all of the science works. I only know how a lot of it works. That's what the scientists are for. What I do know is that because this isn't the forum to debate the data, this is the forum to debate the impact of a philosophical exemption. I agree, we should have medical exemptions. That's what the science backs up. Few people would require a medical exemption. And those instances are studied, and they are proven by scientific method. It's hard to study and prove philosophy. And I don't think a medical exemption should be under the guise of a philosophical exemption. If a child requires a medical exemption, they should get it. But we shouldn't lie and say that a medical exemption needs to be labeled as a philosophical exemption. If you want to debate the medical exemption, then that's a different forum. Right now we have children in the hospital. We've had children in the hospital all year that are not doing so well, and they have vaccine-preventable diseases. Some of them were vaccinated, and there wasn't enough herd immunity to protect them. Some vaccines aren't perfectly effective, and they may not have worked as well as we want them to, but other children are there because they couldn't get vaccinated. And we do the best we can with our vaccines, and we are constantly studying them. And I've spent my short career and at this point, the majority of my life trying to help children and study this on a scientific level.
And I think everyone wants to help our children, and I think the best way to do that is scientifically, and by studying it the best we can. And by allowing for philosophical exemptions, we are bypassing the science. And it would be a lie to put medical exemptions under philosophical exemptions.
Thanks very much. I appreciate the time of the committee and the chair for giving me this opportunity. My name is Dr. Ian Michaelo. I'm a pediatric infectious disease doctor. I work at Hasbro. I'm not representing their opinion. This is my opinion. I trained in South Africa and I trained in the US as a pediatrician, as an infectious disease specialist. I've been practicing over 25 years, and I've done both clinical care and as well as research on pneumonia and meningitis, brain infections, bone and joint infections in children. And a lot of these diseases are preventable by vaccines. What I've witnessed firsthand is a lot of severe disease, but also mild disease. Not all these diseases cause severe disease, but I'm talking right now about the severe disease that I've seen, crippling effects that are long-lasting, lifelong in some cases, and in some cases death. And I think we can all agree that the goal is to eradicate disease. That's what we work for as a society, as healthcare professionals. And one prime example is that we eradicated smallpox, which was through a vaccine. Subsequently, we don't have to deal with, thankfully, with polio in this country and in most parts of the world, and that was thanks to the vaccine. And there are many more examples like that. We've dealt with infections. Hib is one where we don't see it much now at all, which was a very important cause of brain infections and bone and joint infections. And thankfully, we're in a position now where we don't have to worry about those things. So when it comes to individual choice, and the two main points I want to make, the individual choice about vaccines, unfortunately, is in direct contrast with what we would like to achieve as a society. And in order to do that with vaccines, we need a certain amount of what we call herd immunity, where at least 90% or more, we said 95%, 93 to 95% of people in any particular community have to be vaccinated for vaccines to work. When we hear people say they support vaccines but not for my child, that's not taking into account the fact that the way vaccines work is at a community level that a certain number of people have to be vaccinated for it to work. And that brings me to the point about somebody gave testimony about their child who had the THFR mutation in kids, in their child. And the problem with that is that, what exists right now with your healthcare professional, you can discuss this and not get a vaccine if there's a medical reason. The problem is that those children who are immunocompromised with mutations like that and others, children who have immunocompromised states or cancer who are immunocompromised, it's those children that we have to protect. And so it's that particular child that the person was talking about that we want to protect. The way to do that is to vaccinate everybody around them. And that's called the cocoon effect. So we protect those children, that particular child of the person who's here, by vaccinating everybody else. And the problem is that there are philosophical objections that individuals, by removing themselves from this pool of community protection, are putting those very children at risk. So I have a very strong opposition to this particular bill.